Top 10 warning signs and symptoms of prostate cancer. Prostate cancer is a very serious type of cancer for men. It's the second most common cancer in males after skin cancer. About 1 in 9 men may get prostate cancer in their lifetime. In 2022, around 200,000 men in the U.S. will be diagnosed with it, and more than 40,000 may lose their lives to it. However, if it's detected and treated early, it's less likely to be deadly, so it's important for men to know the early signs of prostate cancer. What you should know about prostate cancer. Prostate cancer is often a topic that doesn't capture the attention of most men until it becomes a cause for concern. Nestled beneath the bladder and surrounding the urethra, the prostate plays a crucial role in producing seminal fluid, aiding the exit of sperm from a man's body. The primary type of prostate cancer, adenocarcinoma, arises from gland cells and accounts for the majority of cases. Notably, there are 2 distinct categories of this cancer, one that progresses rapidly and another that advances at a slower pace. Some men may unknowingly harbor prostate cancer for extended periods, devoid of any noticeable symptoms or complications, as reported by the American Cancer Society. However, the potential risks associated with prostate cancer can be quite substantial, particularly if the disease spreads to other parts of the body. Fortunately, there are observable symptoms that individuals can self-diagnose. Yet it is crucial for men to maintain regular prostate checkups conducted by healthcare professionals to ensure early detection and timely intervention. In this video, we'll be discussing top 10 warning signs and symptoms of prostate cancer. Before we begin, please subscribe and like. Now let's begin. Number 10. Pain or burning during urination. Painful or burning urination can be caused by prostate cancer. This happens because the cancer makes the prostate gland larger, which can block the normal flow of urine. The pain during urination can also occur if the cancer spreads to nearby areas like the urethra, bladder, or rectum. Sometimes, infections or side effects from prostate cancer treatment can also lead to a burning sensation while urinating. When the prostate gland gets bigger, it can block urine and cause retention, which might lead to urinary infections and the burning feeling. Taking antibiotics can help temporarily, but it's important to start treating the prostate cancer to prevent future problems. If you have a family history or genetics that increase your risk of prostate cancer, or if you make lifestyle and diet changes, it's important to pay attention to these symptoms because obesity can make the pain worse. To be safe, it's best to consult with a doctor to detect and address any potential prostate cancer issues early. Number 9. Sudden weight loss. Weight loss can be linked to various cancers, including prostate cancer. The main causes of this weight loss are loss of appetite, feeling nauseous, and vomiting. While the exact reasons for these symptoms are still debated by scientists, people with prostate cancer might also notice changes in how certain foods taste. If you're losing weight without a clear reason, it's important to see a doctor right away to find out why. Doctors recommend eating foods with lots of calories to prevent excessive weight loss and may prescribe medication to manage nausea and vomiting. Ignoring these signs could lead to more health problems. Number 8. Blood in the urine. Blood in the urine, also called hematuria, can be a sign of advanced prostate cancer. There are 2 types of hematuria in prostate cancer. Microscopic hematuria means you can only see it under a microscope, while macroscopic hematuria means you can see it with the naked eye, and the urine may turn red or pink. About 3 to 5% of prostate cancer patients may have blood in their urine because the cancer can affect the urinary system, including the kidneys, ureters, and bladder. To figure out the cause of hematuria, doctors often use tests like urinalysis, urine cytology, genital and rectal exams, urine culture, and ultrasound. Regular urine tests are important for a proper diagnosis. Number 7. Frequent pain. If you experience pain in your lower back, hips, or legs, it could be a sign of prostate cancer that has spread to your bones. This type of cancer can affect new bone cells, causing severe discomfort. Studies have found that men with back pain have a higher risk of having prostate cancer. Advanced prostate cancer can also lead to weakness and numbness in the limbs. If you have unexplained pain in your lower back, hips, or thighs, it's important to see a doctor for evaluation. Number 6. Frequent nocturia and urination. Frequent urination and nighttime urination can be concerning indicators when there is suspicion of prostate cancer. Nocturia, a condition where individuals must awaken repeatedly during the night to urinate, can significantly disrupt sleep patterns and potentially exacerbate a patient's overall health. This constant need to visit the restroom throughout the night may lead to morning exhaustion. If you find yourself bothered by these nightly interruptions to empty your bladder, it is imperative to promptly consult a physician. An invaluable tool in assessing the severity of the condition is a bladder diary, which requires meticulous tracking of a patient's 24-hour urine output. Such a diary serves as a crucial instrument in diagnosing and managing this disease. Number 5. Pain in the rectum. If you've got prostate cancer that's spread into your butt area, it can lead to some painful issues down there. This might include pain in your rear end because the cancer is messing with your rectum. You could also deal with problems like being super constipated, suddenly needing to poop all the time, accidentally pooping when you don't want to, lots of gas, or even your bowels getting all blocked up. Diarrhea might also make an appearance. If you're going through any of this, don't wait around. Go see your doctor as soon as possible. They can check things out by doing a digital rectal exam, an ultrasound, or a PSA test to figure out what's going on. The sooner you do this, the better you can deal with it. Number 4. Painful ejaculation. Experiencing painful ejaculation can significantly impact both a person's sexual relationship and their self-esteem. This distressing condition affects approximately 2 to 3% of men, particularly those with prostate cancer. For these individuals, the agony during ejaculation can be excruciating, and the discomfort that ensues may persist for more than 24 hours. While some have occasionally reported discomfort before ejaculation, it is far more common for patients to endure this pain after ejaculation has occurred. This challenging situation underscores the importance of seeking medical attention and support to address the physical and emotional toll it can take on individuals and their relationships. Number 3. Pain while sitting. Sitting for a long time can be painful if you have an enlarged prostate gland. People with prostate cancer often feel uncomfortable and numb in the pelvic area when sitting on a hard surface. This type of cancer, called prostate adenocarcinoma, is often linked to sitting discomfort. If sitting causes pain in your pelvic or lower back, it's a possible sign of prostate cancer. Number 2. Problems urinating. Difficulty urinating can be a significant concern for individuals with prostate cancer. This problem often arises due to urinary retention within the bladder, making it nearly impossible to pass urine comfortably. The main culprits behind this issue are the tumor's local invasion and an enlarged prostate gland. To address this issue promptly and seek appropriate guidance, it is highly advisable to schedule a consultation with a urologist at your earliest convenience. Number 1. Loss of bladder control. A loss of bladder control can be a warning sign of a problem, often called urinary incontinence in the medical field. It can vary depending on the type of prostate cancer. There are 2 main types of urinary incontinence: stress incontinence and urge incontinence. This loss of bladder control can be a sign that the disease is getting worse. Common treatments for prostate cancer, like radiation therapy and prostatectomy, can cause this condition. The prostate plays a role in controlling the flow of urine from the bladder to the urethra. After a prostatectomy, the bladder may struggle to hold urine, leading to dribbling and nighttime bathroom trips. Surgery on the prostate can damage nerves connected to the bladder, causing urinary incontinence as a side effect. About 25% of men with prostate cancer experience this loss of bladder control due to the various treatments available. Now that you're aware of certain symptoms associated with prostate cancer, have you considered your own risk? Among the various risk factors associated with this condition, one notable one is advancing age. As you continue to grow older, your likelihood of developing prostate cancer naturally escalates. This condition becomes notably more prevalent after reaching the age of 50. If you enjoyed this video, like, share, and subscribe, and click on the bell icon so you never miss a video. And now over to you. Have you experienced prostate cancer signs? Leave your comment below. We'd love to hear from you. And be sure to check out our other videos.